Everybody, welcome. Thank you so much for coming this evening. If you've been here before, you will recognize me or my voice. I'm Courtney Kowalchuk. I am a psychotherapist. I've been doing this just under 15 years now, and I specialize in children and adolescents. And it's a bit of a passion of mine to meet with parents, talk to parents, help parents with concerns that they have and just like helping parents be better parents. And that is, I think, my goal with a lot of my information here. So we're going to go ahead and jump in. Tonight's class is going to be on anxiety and or worry in children and adolescents. We do kind of try to span the whole age range, although there are some significant differences between really young kids and older kids. And so for the sake of time, I'm trying to give you guys as much generalized information as possible so it helps the most of you. Um, yeah, the way that I like to do this is I like to have more of a conversation class. So I love when you guys ask questions, when you have personal situations that you're asking about. If you don't want to do that on your microphone, we just ask that everybody keeps their mics muted, and then when you want to speak, you can literally just click your mic on, and I'll get a little signal that you want to say something. Otherwise, you can put things into the chat. I'm looking at that consistently to answer questions or just get feedback. And my hope is that this is helpful for you and at least you can get some camaraderie with other parents and we're all kind of in this together. So, with that, we're going to go ahead and get started. Normally, what I like to do is I'll try to break around 6 just to break for questions once I get through kind of half of the presentation. And typically, I try to break at the end, depending on how many questions I get throughout. So, other than that, I don't think there's anything. Thank you guys again for being here. And I'll tell you guys a little bit about myself. Like I said, I am a board certified clinical therapist. I've been doing this for just under 15 years. I specialize particularly with children and adolescents, as well as trauma and parenting. A lot of my certification comes from the positive discipline modality. And so I've been certified and trained for both being a parent and teacher educator. And that just means that a lot of my suggestions, strategies, and a lot of my theories surrounding parenting pulls from positive discipline. And I also just kind of take a bulk of all the other types of parenting, and that kind of gives me what my experience is today. So a little bit about my experience. I did a lot of my training at Rady Children's. I've worked in the San Diego school districts for about 15 years now. Had some service in the Air Force, and I've done a lot of psychiatry clinics, both inpatient and outpatient. Um, just to kind of give you guys a little bit of information about me and why you guys can trust the information that I'm giving you here. Okay, so as stated, we send the flyers out. Hopefully, everybody's getting those. The flyers generally are going to give you guys these objectives, things that we're going to talk about tonight. Um, Normally, what I want to start with in a presentation tonight, like tonight, is just to help you guys gain understanding about how anxiety can affect the brain or impact the brain, particularly the developing brain. And the reason why I think this is important is that I do think that we are seeing a rise in children being diagnosed with clinical anxiety. And yet, what I want to kind of let you know is not every child who has worry or even anxious thoughts or some of the symptoms has or will get a clinical diagnosis of anxiety. And I'm going to kind of help you gauge, hopefully tonight, whether or not you I'll get you to feel more comfortable with that question. Does my child need a little bit of extra help, or is this just kind of like general stress or worry? I obviously want to help you guys learn different ways, to help your child or student during these times, uncertain times, stressful times, any times when they're feeling anxious. What can you do? How can you respond to your kids when they have anxiety or worry? I want you guys to be able to network with other parents. Obviously, that's kind of why we're here. You can share your story with other parents, hopefully get support. We've had people chime in, other parents actually give us resources. We can get your emails and send you extra resources, hopefully on the side. That stuff is very, very important, especially from my perspective as a therapist, because I do believe that a supportive network is very crucial to our success as parents. I don't believe we can do it alone, and many of us are tasked with doing it more solo. And it takes a village, and we don't have those villages, so to speak, anymore. And so we want to give you a little bit of that by way of networking and being with other parents. You can, you're going to be given resources to help support your students. One of these will be a practice exercise, and I have that handout in the chat. We can probably put that, we could either put it now or put it when we get to that, Annie. That's up to you. We'll get to a slide where we'll talk about that. And we'll definitely be able to give you guys some resources if anyone needs, has questions or needs extra help. We're definitely going to be able to improve your coping and the coping of your kids, help you help them. And we will have a survey at the end of the night. I added that onto this one just because we're getting kind of close to the end, and we definitely want to know what you guys want to learn about possibly with the next round and what you've enjoyed about these presentations, what you think needs improvement, what you like, what you don't like. We value your feedback, and I can certainly handle it. And so I want you guys to just tell us what you think. And that's what we're going to do tonight. Okay, generally, I like to start with a question. And my question for you all is, as parents, what types of things are causing stress in your children's lives? And what is their typical response when they're stressed or anxious? What do you see? This question will give me some understanding of maybe kind of who's here, what your kids are dealing with, and that can also help tailor my responses when I'm or giving examples. So let me know, what types of things are stressing your kids out right now? What kind of things really produce anxiety you, for your children, and how do they behave when they're stressed or anxious? You can throw responses in the chat if you guys are on a desktop, or you can um, put that in, kind of toggle over to the chat if you're on your phone. Okay, so one parent says divorce and relocation. That's incredibly stressful. Yeah, for everyone, for the parents, everybody involved. Absolutely. And I know that this one has been really common too. There was a point when I was doing one of the presentations where I talked a lot about divorce and co-parenting. Um, I think just like the breadth of that information, we kind of were hearing feedback from parents that they wanted some other things, and so we kind of replaced that parent academy. But I do think that there's a very unique stress when we talk about divorce and of course relocation. Moving to a different place, starting a new school, having to meet new friends. There's so much stress there. Okay, thank you so much, Kathy. So like something she sees is the reaction to stress, getting easily agitated, lashing out. So like behavioral concerns, like things that come out in their behavior. Absolutely. And I think I can really identify with that too, right? When I'm stressed, I'm a little bit more agitated. I don't like to admit that, but I know that I am. Let's see, fear of failure. Okay, before quizzes. So that might be more like the academic pressure, the academic demands. Yeah, absolutely. Thank you guys so much for your responses, for your feedback. Yeah, I think ultimately what we see here too is like these are really common stressors for kids. I think for the most part, I'm not sure if I put that in here or not, but I will certainly talk about, yes, I did. There's a slide where we talk about kind of like predominant sources of stress for children and adolescents. I think one of the biggest ones is going to be academics, right? That's kind of their wheelhouse, their jobs, so to speak, at this time. And I think a lot of kids, when they do start developing stress, fear, worry, or eventually anxiety, a lot of it is really centered around performance academically. Definitely socially or relationally, right? We're hearing parents say like their behavior, they kind of get agitated, they lash out. There's this stuff with like divorce and families. Absolutely, the social realm is another really huge source of stress. Yeah. And so I guess what my next question would be for you guys that are here, and willing to get vulnerable and engage. Are you parents confident in recognizing and addressing stress with your kids and or anxiety, stress and or anxiety? Are you confident in your ability to recognize and address it? I think this is a really big one because I think a lot of us as parents, I'll even speak from personal experience, right? I really struggle sometimes because I don't necessarily know what to do, right, for any given situation. And I do have a lot of training and I do have a lot of knowledge on this whole realm, but there's a lot that, nobody tells us exactly how to handle every single situation. And I think that confidence in our ability to handle that really makes a difference in both how we handle it and how our kids respond, how our kids handle it. Okay. And a parent says, sometimes I realize I may be causing him stress when he wasn't necessarily stressed. Absolutely. So maybe he feels things from you. Maybe I'm hearing you say that. Or he wasn't stressed and you're like, wait, you're stressed. And he's like, no, I wasn't. And that actually makes him more stressed. It could be either one of those. That realization is a really wonderful thing though, right? And I think that's a good tool, a good skill, a good characteristic to have that hey, am I causing more stress? Like if I handle this differently or if I handle this okay, or my stress rubs off on him. Yeah, absolutely. And we talked a little bit about this in the last class, right? If we see that our kids are anxious or stressed and it causes us to be anxious or stressed, which is almost 100% likely to happen, right? We're human beings and other people's stress and mental state affects us, especially our kids, because we want to fix it all and we feel like it's our responsibility. So our stress absolutely can rub off on our kids. And it's really hard. I think that's one of the biggest things as a parent to handle is we're always told, right? Be calm, be calm, be calm. And it's so hard. It's very difficult. Even for me, I'm a therapist and it's very difficult for me to stay calm. Yeah, my kids are 13 and 14. It's getting harder and harder. Oh, absolutely. I hear you. This is so hard. And my hope is that you get some stuff here that can help you. Okay, I feel that I cause them stress. Yes, I have been there and I have felt that too. I definitely think that like parenting in itself causes stress to our kids, right? Because there's friction in the process of somebody telling you to do something or that you've done something wrong or right like just holding rules and limits and boundaries. There's stress and tension in that process very naturally, and so sometimes it's like, oh my gosh, I'm causing them stress, right? I'm the source of some of this or a piece of this. And I would encourage in that situation, that is the natural way of things. And I think that if you're doing it right, you're probably causing a little bit of stress, right? Now, I think there's a method and there's a way, especially what we've talked about in the previous classes about positive discipline. So if you did not get to see those classes, I would absolutely recommend you go back and check those ones out. The recordings Annie shared in a link at the top of the chat. If you get a chance to look at those, positive discipline and just like the type of discipline and strategies that I'm trying to give you, beyond positive discipline, the realm of positive discipline. I'm really just trying to help you guys be really warm in your parenting, but also have that high demand, right? Because having limits, demands, boundaries on our kids is especially important, but also we've talked about being really warm and compassionate and connecting before we correct and things like that. And so we're going to cause stress, but we can mitigate that to a degree with how we say things, what energy we create in the home, how we react to them when they make mistakes or they don't listen or they do things that we think they're just doing it on purpose to like irritate us, right? Like how we respond to all of that can certainly make a really big difference in their mental state for sure, and just kind of the energy in the house. Okay. If anyone has anything else that they want to share about this topic, stress, anxiety, how it affects you as a parent, where you're getting your information, and if you have anything to share in terms of where do you get your information on this type of topic, share it with us, throw it in the chat. If you've got books or classes or resources to share, I love that. I'm always looking for new things, especially in North County for parents. So if you have anything, I'm going to share some books that I really love near the end of the presentation. I love books. I know a lot of people are not total book people, but now that they have like audiobooks, those are can be really helpful as well. Okay. So we're going to go ahead and jump in to the meat of the presentation, which is I'm going to hopefully we're going to hit this first bullet point right where I'm going to hopefully dive in and do a deep dive into anxiety and anxiety in particular in adolescence, because I think it's really important that we differentiate. Anxiety is quite different in adults than it is with children. And the main reason for that is because the fact that we're talking about children being in that developmental stage, that developmental process. It's shows a little bit different and we react to it in a little bit of a different way. There's certainly a biological difference as well because of the hormones and all of that, and we'll get into that. But really, what I want to help people understand is that it does look very different. And so, this is sometimes what makes it exceptionally hard for parents to be able to kind of cross that line of saying, okay, well, I kind of know what it feels like when I have anxiety as an adult. But what we really want to do is learn about what this looks like for kids, because what we forget, or sometimes are just like not aware of, is that how different the brain is, right? And so, because of that developmental process, there's a huge difference in both the structure and the function of the brain. And so we will get into that particularly more on the next slide. But what I want to talk to you guys about with our first point is that anxiety is the body's normal stress response. Okay, so what I sometimes have to remind people, especially maybe in the era of social media, is that anxiety is very normal. It's a normative psychological experience for all human beings. And what we want to help people understand is how to differentiate the two. Now, I've said this before, there's kind of the quick disclaimer that I'm not expecting anyone to be a clinical expert. If you need a diagnosis, you're always going to need to get expert help from a person like me. But the reality is we can help you guys kind of understand some of the function and that developmental process so that you just get a good idea of, okay, maybe this is just kind of normative, maybe this is not. And it just helps you use that mental filter and your gut reaction better. So while anxiety is the body's normal stress response, right? There's a big difference when we talk about clinical anxiety and diagnosed anxiety diagnoses or diagnosed anxiety. And what really happens is normal stress is not going to affect all domains. And when we talk about domains, that's just the different parts of life, right? When we talk about like for children, it's most likely going to be school is a domain, right? Academic performance is a domain. They're going to have a social domain, right? Interpersonal relationships and how they respond to the different relationships in their life, whether it be friends, family, all of that. That's another domain. The other domain is going to be like physical or biological health, right? And then we're going to have something that's a little bit more the environment is another domain. So what we want to see is this child being affected to the degree where it's affecting all different aspects of their life, right? If a child's anxious, but it's really only showing up at school, then we might say, okay, it's not going to be necessarily to the clinical degree. And now there still might be absolutely things that we can do to help and things that we can change and ways that we can address that. What we want to just see is that clinical anxiety is going to be a lot more widespread. And so having that information, we can kind of go back to this like it's a normal not normal body response, right? Stress response. Stress is shared by all humans. And I think one of the big things is helping kids understand this, explore this with your kids, teach them about it, right? That nerves are normal, nerves are good, right? They have a function, right? Feelings have a function. And what are they, right? I think a lot of people sometimes we tend to kind of forget this piece that is nerves are normal. And we really want kids to be able to feel nervous, to feel worried, to feel fearful even, and then push through that, right? And so I think there are ways that also we respond or the world responds, and things can kind of go in a different direction if we are too also afraid of their fear or worrying about their worrying, instead of really helping them normalize some of that, right? We can definitely make a difference there. And so taking that and saying, we can explore, we can help our kids understand that they don't have to be afraid of things to a degree of like not, right? It keeps them from acting, it keeps them from doing things. We want to help them say, look, I understand it's okay to feel afraid, it's okay to feel worried. That's really understandable. I think anybody would feel worried or scared in that situation, right? And that's kind of some of that validating language that we can use. And then, as what we know as parents, or what I will teach you tonight, is that excess anxiety or excess worry, where we really start to see it cross over, right? And it's touching more of those domains, that's where things get more problematic. And so, a couple of things that you can ask yourself to help differentiate this idea, right? Is this response or behavior short term? Has it been going on for a short amount of time, right? Maybe like less than last 6 months. 6 months or less? Is it a little bit more short term? Does it come and go, right? Is it periodic or cyclical? Is it situational? Are there circumstances in their life, like a parent shared earlier today? Is there a divorce that happened recently or a relocation that happened recently? Is there a death in the family that happened recently or a huge social change that happened, adding a sibling, removing a friend group? There's a lot of different things that really situationally or circumstantially can cause peaks in anxiety or depression. We kind of talked a little bit about this in the depression conversation from 2 weeks ago as well. Or is this really sudden and inexplicable, right? Unexplainable? Can we see a clear cause, right? Is this something that really just doesn't make any sense? We have a parent that's like, look, they come to me and they're like, we don't really know what's going on. There's no reason. Like, we haven't had some really big thing happening, but there's a lot of anxiety that's come up in the last like 3 months and it's not getting better. It's getting worse, right? We don't know how to handle it. That's kind of more along the lines that's going to tell you it might be something more related to a clinical issue. Has there been any recent trauma, right? We talked about that. We all are very familiar with we're all very familiar, and yet the evidence hasn't caught up to us about, I think, the trauma of like COVID-19 and what that did to all of us, right? The recent trauma there, now, goodness, we're 6 years away from that, which kind of seems bonkers to say. But has there been anything recent that has maybe caused this? Have your children changed since that particular thing when kids were, more isolated and they left their schools and they had to change socially? I think a lot of people that I know, kids have really struggled in the academic realm because of that. And so, how can we pay extra attention to that and also help them heal from that? Has there been chronic stress, right? We typically talk about things, is it acute or is it chronic, right? Is it kind of coming up out of nowhere and it hasn't really been repetitive, or is this a repeated source of stress, right? Possibly like domestic violence in the home, lots of conflict, drug use or substance abuse or mental health issues in the family, things that are poverty, right? Consistent stress over and over and over again. These things are also leading us more in the realm of, okay, there might be something that we can do with a little bit extra, right? This might be more in the realm of clinical if it's chronic, right? Genetic predisposition, which Jay basically is just like there's a hereditary component to anxiety, right? And we know that. We talked about this a little bit with depression last week, but kids who have a direct relative like mom or dad, right, that has a diagnosed mental health condition are anywhere from 2 to 4 times more likely to also get that same condition. And so there is a hereditary component, there is a genetic component, and we don't exactly totally understand that yet. And yet, what's really helpful is if you do seek help or you do have a child who has some of these symptoms or things, you can kind of go in your do that check in your mind. Do I know that maybe my mom or my dad has had really like significant anxiety? Maybe it's never been diagnosed, but I can really tell that there's something there. Maybe that's going to, up your child's risk, so to speak, of one of these conditions. We already talked a little bit about environmental changes. That could be a lot of things, but I think a lot of what we see with kids is moves, frequent changes in schools, right? Divorce or relocation, and that's a big one. We talk a lot about just difference in environment, an environment that a child's not used to, right? Maybe they go from one area to a completely different area and the weather is very different. The people are very different. Their environment, meaning how they get to school, how they get home, how much socialization they have, all of those things can make a difference. One thing that we talk about, and this is kind of shifting gears a little bit, those are some questions that you can ask yourself about your own child if you have concerns to get you in the right headspace of whether you should seek help or not. What I want to go to next is that predominantly when we're talking about the differences of anxiety in adults and children, is that the brain impact is a driving force in kids and adolescents, and it's predominantly because of hormones, right? The hormones of puberty plus the pressures from the external environment, right? These things reshape the central nervous system, which basically just means that there's massive change biologically in puberty, and this has been linked with an increase or uptick in mental health issues, right? So, what we see is that from very young, kids are very unlikely in terms of prevalence to get a diagnosable mental health condition. However, once a child hits puberty, that changes, right? Most really young kids are not getting diagnosed with, significant mental health disorders. And yet, what we really see is an uptick in children and adolescents. Now, we still see rates are incredibly low given the normal population, right? However, we do see a rise in that recently, like I talked about. We see a rise in that since the like 2010s. It's really increased significantly to researchers, which is not a significant increase kind of in the normal world. But the point I'm trying to make here is that puberty does tend to increase these issues. And so if you have a kid who's either going through puberty or recently gone through puberty, you might be seeing some of this. And there is support data to support the fact that these massive changes in development, particularly with hormones, can cause an increase in anxiety for your kids. Okay, so we're going to kind of jump in and talk a little bit about the science of anxiety. I had mentioned earlier, right? This is a really normal process. The stress response is normal and native to all of us. And the reality is that this is how it works. The brain structure is here. I have a little picture, and this is the brain structures that are involved in dealing with fear and stress. And so what happens is the decision-making area of the brain, it determines a threat, right? And the decision-making area is the prefrontal cortex. It's what you see as purple. This triggers a response in the amygdala, which is the tiny little reddish yellow structure that you see in the bottom center. This tells the hypothalamus to initiate the fight or flight response within the central nervous system, which I'm sure all of you guys are really familiar with, right? The central nervous system, the sympathetic nervous system activates, which means that's the fight or flight response. That means your heart rate increases, your blood flow is reduced, your muscles get tense, right? Typically, the bowels empty, right? Breathing rate is increased. Our body is going on, I have to fight or flight, right? I have to run or fight, escape or fight. And so what's happening is, and this is why I put in here GI upset. This is why a lot of kids with anxiety complain of GI upset. They get stomach aches, they get diarrhea. I don't feel good. I feel nauseous, right? There's a lot of that when it comes to anxiety. So we see tons, especially in kids. We see a lot of somatic complaints. We call them somatic complaints. It's really just the body's way of responding to stress. And kids aren't necessarily, they don't have the kind of emotional sophistication that adults have, right? So a lot of times they're going to tell you, oh, I just have a stomach ache. I get a stomach ache every day when we go to school, or I have to go to the bathroom every day before school, or I really don't want to, right? And it's very, very common. So kind of keep your eye out for that. And this is really why that happens. Um, I had said this before, anxiety disorders are the most common of the mental health diagnoses in the United States. Rates really did skyrocket in the 2010s. And in the presentation, it's not next time, but the time after, I'll talk about technology and social media. A lot of research now is focusing on that skyrocketing in the 2010s and the development of the first iPhone, the first smartphone. So I'm kind of going into this whole conversation of now clinical anxiety disorders and the variety of diagnoses, right? There's panic disorder, post-traumatic stress disorder, and acute stress disorder. There are phobias, social anxiety, generalized anxiety disorder is the most common. What I would ultimately recommend in this line is obviously if you feel as though you're concerned, obviously we have to always seek professional evaluation. And I would start with your pediatrician with your child if that's a concern for you. What we also want to look at here is the limbic system. And this is the center portion of the brain. It's comprised of the amygdala, the hippocampus, and the thalamus. Not all of those are shown on the diagram, but just kind of if you were to think about a tiny little ball in the middle of the head and the center there, that's where those structures are. These are responsible for the majority of emotional processing in the brain. And this is also why at later times in this presentation, I will talk about what's called grounding. It's a psychological process by which we shut the limbic system down, and that's why it works. So I will try to at least teach you guys that as one of the skills to teach your kids before we go today. What we do find in the limbic system is that when we do brain scans on anxious individuals or individuals who have diagnosed anxiety disorders, they have much higher activity in the limbic system region of the brain. And really, that's just telling us, right, that there's a lot of activity there. We can definitely prove that those things are related. And we also want to prevent those types of things by helping kids learn how to emotionally process or manage or regulate emotions, because we tend to not see that activity in kids who have learned those things. Neurotransmitters are essentially responsible for communication in the brain. We talked a little bit about this in the last class as well. And ultimately, what we find is that there's a disruption in balance of the neurotransmitters in persons diagnosed with anxiety. And the main point of this is that this is why medication is typically recommended when we talk about severe clinical anxiety disorders, because there does tend to be a disruption in the balance, right? They talk about brain chemicals. There's a kind of different difference between those, and that can be really helpful for some people. I think typically for kids, you're going to obviously want to see a specialist, which is a child psychiatrist or an adolescent psychiatrist, someone who's trained specifically to see kids, and then use your best judgment on whether you want to try medication or not. Typically, what I say is, I always recommend as a psychotherapist that people try a good trial round, which is anywhere from 3 to 6 months of therapy before trying medications. And yet, that's the opinion of, some therapists, maybe not all psychiatrists recommend that, but that is a recommendation that I make. Um, let's see. Mentioned that anxiety is normal. The slide said it's the most commonly diagnosed disorder. It's almost as if it's not okay for kids to feel anymore. Be sad, mad, scared. Yeah, I think that's an understandable statement. Yeah, anxiety is normal, and certainly worry and fear and nervousness. And yes, anxiety is the most commonly diagnosed among the mental health disorders. And so I think that point is just to delineate that anxiety is more common in the mental health realm, and yet absolutely, I'm not sure if you're kind of getting to the conversation that maybe kids are overdiagnosed because they're like not allowed to feel, which could be said. There could be an argument for that to a degree. And yet I think, yeah, as a population, we just have to do better about normalizing certain things to a degree, and then not really over pathologizing all these behaviors. And then just kind of like leaving the experts to do, what they can do in terms of evaluations. But I think absolutely, some people I think are afraid of kids feeling, right? Especially when they're like, oh, my kid's anxious or he's afraid of this, he doesn't want to go. Um, there can be a tendency to kind of get worked up about that and not know what to do. Whereas I think, as like I said, a kind of as a population of parents, I definitely think we can normalize a lot of those behaviors and help kids really learn how to respond to them and in a healthy way. Um, and I think that's a good point for sure. Okay, let's see. That was a really good comment. Thank you for that. Yeah, and so that conversation as well kind of triggers this conversation that while anxiety disorders are the most commonly diagnosed in the United States, for kids the rate is still quite low. For kids to be diagnosed, it's typically around 1 in 12, and that's for kids aged 3 to 17. And I think it's the most common out of all the other mental health disorders. So we talked about depression. We'll talk about some of the other ones next week. And yeah, it's still fairly low, right? There's majority of kids that go through childhood and do not have clinical diagnosed clinical diagnoses, right? If we're saying even generously 15%, that would mean um, right, 85% go without that. So I think those are good numbers, but yet we're still seeing an increase, like I said, and a very dramatic increase in terms of if we look at the data as a whole or we look at the data from the last 15 years, looks very different. And so that's concerning. And as a practitioner, I we have to think about that and figure that out and help address that. But that's a conversation for another day. So thank you so much for the feedback and for sharing that with us. Sometimes it does feel that way. Okay, so some common symptoms, right? We're going to look for certain things, or uh, these are some of the behaviors that you might see if your child is struggling with possibly more than just worry and stress. You might have kids who avoid certain places or people, right? They might get extremely clingy when they're separated. Now, there is a very normative process that we go through, especially in really young children. They will be clingy when separated. They will cry. They will scream. They will tantrum. They will melt down. That is all very normative of that developmental phase, right? We're talking like 0 to 5. There's going to be a lot of that separation anxiety, and that is very, very normative, very normal. Now, once we get into uh, 6 and 7, 8 beyond, right? Then we're kind of looking at something, okay, what's going on when there's a lot of this separation anxiety between a parent and a child if the child is over 5? So I would look at age, and then I would look at, are they avoiding certain places? Are they avoiding people in general? Are they avoiding social situations? And this again would go across the board. So it wouldn't just be at school and it wouldn't just be at home, right? It's going to be everywhere and all the time. You might get consistent reports of stomach aches, headaches, GI issues. We see this a lot, right, with kids, and I explained why. This really has to do with the activation of the sympathetic nervous system. And that really just means that fight or flight is getting activated more often than it should be, right? With worry and nerves and fear, all of those things are going to produce a small amount of this, right? And it will come from that very scary situation happening, and then you'll immediately see something. This stuff is being triggered all the time, right? In inappropriate times, right? We talk about like when you have to make a really big presentation in front of your boss, right? That's going to cause some anxiety. You might get a little sweaty, you might feel a little agitated, you might not sleep right in the couple of days leading up to it. You're trying to prepare, right? You're constantly moving and getting things ready. This is all really normative, but if we're seeing that and then there's no known trigger, or the trigger happens when the child's doing something random, or there's not a very clear trigger, that's kind of more when we get concerned. Racing heart, shortness of breath, irritability or easily agitated. I think irritability happens, like I said, more so with kids. We're going to notice more of the behavior, right? The interpersonal relationships at home, at school, with teachers, with parents. Sleeping too little very often has more to do with anxiety. Sleeping too much, maybe more so with depression. Having frequent nightmares, this could be bedwetting, this could be sleepwalking. We call that parasomnia. Some of those things. Now, that's not always anxiety. We have hereditary components for parasomnia and different parasomnias, and that doesn't always mean anxiety. I will, that It does happen. I have a 5, almost 6-year-old daughter who is a little bit of a sleepwalker. And, one of the things is that you start to kind of worry, like, oh, is something going on, right? Is she having some anxiety about things? Of course, I'm a therapist, so this is how I think. But really, it's hereditary. It happens in our family. Unfortunately, a lot of the women in my family have been sleepwalkers. And so try to kind of take that into account. That might not necessarily mean that. All right. Low energy or difficulty concentrating. We're going to probably see this more at school, right? You might see impact to energy, but I think most parents are going to see this with reports from school or concerns from school or your child mentioning that. The most predominant thing is that you'll see a decrease in academic performance, a decrease in grades, constantly moving or being unable to sit still, right? It's that restlessness, frequent tantrums or behavioral issues. A lot of the times these are not goal directed, right? There's not a goal that the child has from the tantrums. They're more so a little bit more random. We might not be able to totally understand that because if it's anxiety based, it won't be clear to understand for us. Constantly discussing fears and worries, spending increased time alone, avoiding social events or family events. I spoke about this just a second ago, worsening educational performance, skipping classes, skipping the day altogether, frequent absences, refusing to go to school, things like that. Okay, and so you might see some of those things in your kids. And what I would argue is kind of going back to this slide, you're going to see a lot of these things all together, right? If we're talking about things in a more clinical domain, we're going to see many of these. And typically we're going to see some biological or physiological impact as well. It won't just be behavioral. And so this is kind of where you want to guide yourself. Are there many of these things happening? And if you're concerned and you see these things and you can see triggers or you can't, I would absolutely recommend, talking to the pediatrician, talking to the counselors at school, if you think that this might be a concern, because this will be really helpful to just get the kids on the radar and do some preventative work. Okay, the anxious cycle. I'm going to teach you guys a little bit about how the anxious cycle is repetitive and not just that it's progressive, right? The anxious cycle, you can really try to help your kids understand this. And I think giving them, you can screenshot this, you can explain this to them. We want to really normalize and validate their feeling because what we want to do is say it's really understandable to feel that way, right? Now, we wouldn't just validate and then kind of leave it alone, but we want to help them understand what's happening, right? Okay, so this thing happened and now you're feeling this. And they might not be able to look at this, depending on the age, they might not be able to look at this chart or this picture and really kind of understand a lot of it, but you could break this down, right? Something happens and typically an anxious thought arises, right? And in a cognitive behavioral therapy perspective, the thought happens first and then the feeling arises, right? What happens then is the amygdala is activated, the physical responses begin, and rational thought decreases, right? It's the sympathetic nervous system taking over. The anxious thoughts and the feelings increase, and then this is the cycle, right? And typically what happens to further the description of this cycle is that we have the anxious thought or feeling. Anxiety tells us to avoid the situation, right? Don't go to school, don't talk to that person on the phone, don't give the presentation in front of my boss, right? Call in sick, whatever it is. So we avoid it and then the anxiety is reinforced, right? And then the next time, right, your brain calms down, the amygdala deactivates, the stress response goes into parasympathetic mode. Oh, I can breathe, that feels better. And then what happens is we're teaching our brain to avoid the anxiety. And this is where that conversation came in where the other parent mentioned, I feel like kids are just, they're getting diagnosed with these things. It's not okay to feel. And it could be because when they're feeling, they're avoiding and the people around them are saying, let's just avoid that, right? Or we help them by reinforcing that or we enable that response. And then the anxiety grows, right? And the cycle continues. And so that is what I mean by things that we as parents and we as everybody, right? People in children's lives, whether it's like education, administration, whatever. The reality is that we can help them interrupt the cycle and teach them to interrupt the cycle. And so what we do is we do small exposures, right? We expose them in small ways to the things that they're afraid of or nervous about. And we then teach their brain that, oh, I can do that, right? It's that we call it behavioral activation in the psychiatric world, right? We're teaching our brain, the brain learns that pathway. Something scares me, I do this little thing. I actually feel better when I confront it, and then I don't get that cycle again, right? And so I would encourage you, exposure therapy is different than what I'm telling you. I wouldn't do exposure therapy on your child without the help of a professional. But when your child has a worry, right? Your kid's worried about something or there's nerves, the best thing that you can do is start here. Normalize it and validate the feeling, right? Name it. Call it what it is. Oh, you're feeling nervous about this thing. You're feeling anxious about this thing. That's really understandable. I think that anybody would feel that way in your position, right? Now, you can tailor that to whatever the situation is, whether your child's afraid to go to a meeting that they have with their teacher, or a soccer game, or a play date with friends, or going to the movies with a girl for the first time, right? Any of these things, we're going to normalize, we're going to validate the feeling, we're going to name it, and then we're going to expose them in small ways. Right. And that can look like a lot of things. That can look like if your child's afraid of going to the soccer game, right? We're going to go and we're going to say, okay, well, let's get to practice for 15 minutes today, right? Kids refusing to go. Let's just go to practice. Let's just get there, right? Let's drive to the parking lot. Um, Now you're going to have to read your child, right? And you're going to have to use your best judgment here, and you will find out what works really well for your child. But the reality is that we interrupt the sympathetic nervous system by pulling all that information, all that energy away from the limbic system, right? So we talked about that earlier, and I said this is when we do grounding. We help kids ground themselves by saying, for example, your child's really anxious and they don't want to go to school. Okay, well, the limbic system is firing off. They're having that anxious thought. Instead of letting the amygdala go, right, we might say something like, okay, I noticed that you're starting to feel really nervous. Let's sit and name 5 things you can see, 4 things that you can hear, 3 things that you can feel, 2 things that you can smell, and 1 thing that you can taste, right? And we get them in this process of what we call grounding, and it takes that energy away from the limbic system, and we deactivate that beginning of that process, right? And so rational thought doesn't decrease, right? The anxious thoughts don't increase. We're allowing them time to shut that off and then kind of move forward with that. Okay, then we might say, all right, you felt really worried about this, right? It's really understandable to feel that way. I can, I'm sorry you feel that way. I really do, do you want to talk about it? I'm here for you. And then we're going to kind of do these small exposures as we go. Really, what I would encourage most parents to do is, instead of teaching kids what not to do, okay, don't let the anxiety, right? We teach them what to do. We teach them coping skills, and we help them learn how to respond when their body feels that way. And part of it is that like naming process. Okay, I'm feeling worried. I'm feeling nervous. And it could be, they could go, well, I'm nervous about nothing. Okay, well, it's still a feeling, right? You're having that feeling. Maybe you had a thought. Can you think of what you were thinking about, right? That sort of thing. And help your kids. Okay, here's what you can do, right? The grounding, some of the exercises I'm going to show you in today's presentation. Um, okay, so I have a parent who was just wanting to share. Um, let's see. Oh, a parent sharing. Okay. So my son had a therapist for a year, didn't need to see her regularly, started having some anxiety a few weeks ago, able to see her. We're working on this. he gets a feeling of anxiety, has bad thoughts, like something bad's going to happen at school today, or other negative thoughts, I encourage him to have those thoughts. I'm trying to not enforce them. He uses the 5, 4, 3, 2, 1 breathing, naming the amygdala, talking to it directly. Wonderful. And those are great strategies. Deep breathing, naming it, and just saying, like, my brain's doing that thing again. My amygdala is doing that thing where it tells me that I'm really scared, right? Like, we can definitely disconnect from those anxious thoughts by doing that. Absolutely a great skill. Talking to the worry directly, absolutely. I talk about prescribing the symptoms, so like letting kids have prescribed worry time. If you have a kid who's a really big worrier, start saying, "Okay, we're going to set 5 minutes on my watch and we're going to just worry about everything that we need to worry about. But once the clock is done, that's our worry time for the day," right? Now, this is obviously probably going to work better for younger kids. I think you could definitely adapt it with your language and how you're doing. Maybe it would be journaling for to a certain degree, maybe 10 minutes or 15 minutes of worry time journaling with an older kid, but absolutely these things can help. Talk to it directly. The child can draw the worry. What does it look like? What does it sound like? What does it say? What name does it have? When working with really, younger kids, anywhere from 8 to 13, we name it, we draw it, we color it something, we color something crazy, we call it something, and then we talk about like flicking it away and kids get really creative with how to get rid of these thoughts. Absolutely wonderful things to learn and to teach your kids. Thank you so much for that feedback, parent. I am so glad that your child was able to get some help and you guys were able to practice some of those skills because that is truly what will help interrupt this anxious cycle. Okay. All right. So we're going to talk a little bit about some of the more in depth of the causes and the risk factors of an anxiety disorder. We're talking more clinical. We talked a little bit. There's genetic factors that are at play. There's definitely a hereditary component to anxiety disorders. Some kids, right, as anyone, as we're born, personality differences and environmental factors. Talk a little bit about attachment, right? This might be more of a conversation in the last 10 or 15 years. Things having to do with childhood trauma and or attachment, issues with attachment to caregivers as babies. We have really learned probably in the last 15 years that the 0 to 5 time range is incredibly crucial for attachment. This is really the foundation of interpersonal relationships and how we bond with our primary caregivers really gives us it lays the framework for how we develop in terms of our brain structure, how we handle those emotional parts of the brain. I will say there's a really good book, and I think it's in my lobby. I'm going to, at the end of class, I'll go grab it and I can type that into the chat for you guys because it's a really good one, particularly for adults, just to read and to kind of understand. There's a couple of other books that I share. One is called Reparenting the Child Who Hurts. That also is very specific for kids who have had trauma in their childhood, whether it was kids who were adopted or in the foster care system, kids who have had just really severe impact to their attachment. Reparenting the Child Who Hurts is an excellent book to read if you have a child who deals with some of that. I also would recommend that to kids who are maybe not with birth mom or birth dad or the biological parents. Like if biological grandparents are raising kids, reparenting the child through who hurts can be a really insightful book to read and just give you a lot of information on that attachment. Um, Parental conflict and or domestic violence is a risk factor for kids developing anxiety disorders. Early parental separation. So the change in that family dynamic very young. Parental overprotection. We talked about this maybe a little bit earlier, right? Whereas do we let kids feel? Do we let kids bounce back from hardship? Do we I did I think at the very beginning we did one on resiliency. So if you missed that, definitely check that out. Resiliency, I think, in the context of parental overprotection is really helpful because we sometimes can stifle the resiliency in our kids if we're too overprotective. Obviously, child mistreatment, abuse, or neglect increases a child's risk. Oh, we have a book recommendation. Thank you, Julie. I really liked the book Anxious Kids, Anxious Parent. Um, People talking about their own anxiety dealing with these issues. That would be wonderful. I have heard that one. I haven't personally read it, but I have heard that that is an excellent book. And I think I've told you guys this before in some of the previous classes. Was working with a psychiatrist at Rady Children's. He ended up being the psychiatric medical director. His name was Dr. Connor. I don't know if he's still there, but if you've ever got to interact with him at Rady, he's amazing. Um, he was very adamant that when parents got better, kids got better, right? When we're anxious, our kids get more anxious. And so this is not to blame parents in any way, but it's just to help us be more aware. Because I think most of us will struggle with some sort of anxiety or depression throughout our life, some sort of trauma. And I think it's really important to be aware of that and just how it affects kids. I don't know if that's what that book is about, but thank you so much for the suggestion. Absolutely helpful. Okay. We're going to get into some tips, some strategies, because we've been talking a lot about what puts a kid more at risk for an anxiety disorder, how anxiety works in children and adolescent brains, why kids might be more likely in the past couple of years to get an anxious disorder, how to kind of separate and worry versus, normative stress versus clinical anxiety. Now I want to get into some of the tips helping helping your kids improve anxiety. Nancy, this will be yes, in the link where you can watch these later. Absolutely. So thank you for coming. Okay, so stress management, it's obviously really important with people who have anxiety disorders, and this is going to go for everybody. So rather than really honing in on how we treat anxiety disorders, I'll let the people do that in the realm to do that with you in treatment. Now, this will be how you can manage stress. Um, and some coping skills to help your kids possibly enhance therapy's effects. And if your kids are not going to therapy, this might just be for kids who have stress, and this will help. There is a really cool on the right side of the presentation. You can screenshot and then maybe crop that. And this is just little phrases, things that you can say to a child who's feeling anxious, feeling worried, feeling fearful. These are really good, like validating, normalizing statements. And I always find that these are incredibly helpful for me. I try to memorize this stuff as a parent just so that I know what to say and I know how to deal with it when it comes up. And so things like, I'm here with you, you're safe. Do you want to do some dancing or running to get rid of all that worry? You could say, tell me about it, or let's draw it. Let's write a story about it, right? Whatever kind of medium your child really likes. If they like drawing, coloring, painting, doodling, writing, typing, music, right? Um, what would you say to your worry, right? What would your worry say back? So talking to the worry, right? I had a client, we named it, we drew it, we called it something, and then, like I said, we would flick it away or, use our hair and hair flip it away. And it was really incredibly helpful, especially for kids, because we can visualize all of this in a really kind of developmentally appropriate way. What does it feel like in your body? Where's the worry? How big is it? What color is it? Right? Does it feel warm? Does it feel cold? Does it make your heart race? Does it make your chest feel tight? You might say something like, match your breaths to mine. Let's count. Let's think up some endings for what could happen, right? If they're nervous about something or scared about something. Let's think about all the endings, right? Could be the worry ones, it could be goofy ones, silly ones, the realistic ones, of course. What's something we could do to help you feel better, right? Instead of just kind of leaving them in the worry, okay, you're feeling worried about this. That's really understandable. I'm here with you. What's something we could do to feel better? And this can give you some of that language to talk to your kids. And you're gonna generalize that to your child's age. Okay. So what we've found is that meditation has a very distinct and monumental impact on helping individuals calm themselves, right? We know that meditation is directly correlated to better mental health. And so I always try to tell people, don't think of meditation as this very like strict, very classic meditation thing, right? Because some people are like, oh, I can't meditate. My brain is moving too fast, right? Like there's a lot of different ways to meditate. There's a lot of different styles, a lot of different things that you can do. And not all of them involve complete silence and just trying to empty your brain, because that's really hard, especially hard for people who have more what we would call like rapid thought, right? It's really hard to calm that down, and it's hard to calm that down anyway. Um, One other really helpful technique that I use is called noting. This is technically meditation, but I do this at bed, at bedtime. If I'm having a hard time sleeping or I'm feeling anxious about things, what I will do is I close my eyes, I'm comfortable in bed, and I start to count my breaths. And you can teach your kids this. You count to 10 breaths. One is in through the nose, two is out through the mouth, three is in through the nose, four is out through the mouth, and you count to 10. As soon as you start to get distracted because you've either thought about something else and stopped counting, you're just going to note that. I'm just going to note that I'm having a thought, and then I'm going to go back to counting. Very gently, very non-judgmentally. And you would do the same thing if you had a feeling, right? I'm starting to feel really anxious. My tummy, oh, okay. I'm starting to have that thing again. My brain's starting to have a feeling. And then you go back to counting, right? So you're just noting that you're either thinking or feeling, and you're gently going back to counting. And so this is a really helpful meditation practice, and it's very easy to get started with. And you might find that it really helps you sleep. It always helps me every time I've used it when I'm doing the noting and I'm gently focusing on redirecting myself to the 10 breaths. I start over at 10 once I've hit 10. And that is the method called noting. Okay, some other techniques include obviously managing stress, taking time out of your day to unwind, right? Intentional mindful relaxation. I always call this intentional because a lot of people say, like, well, I just am like getting so relaxed on my phone. I'm just scrolling and it's just like, right. But we're not being intentional about calming our mind and releasing our worries during that time, right? And arguably, there's a lot to the phone that is messing with our dopamine and serotonin pathways. That's not actually helping us mindfully relax. And so that's kind of my fight there is do some intentional relaxation, right? Things that are not causing those like peaks and valleys of dopamine and serotonin. So while I do mention YouTube here, I'm talking about YouTube guided audio, like progressive muscle relaxation. You can look that up on YouTube and find something. Turn your phone off and then just listen, maybe in headphones, or you can set it over on the dresser and kind of listen to the progressive muscle relaxation meditation. That can be really helpful. I love Headspace. I have it. I recognized for a time there was a lot of free memberships, but I know that Headspace costs now, and I don't remember what it costs for the year. I think I ended up paying like 12.99. But it's such a good. It helps me meditate. It helps me calm down. There's a lot of different things that you can use, and you can show your kids some of these things and do it with them if you're interested in something like that. Otherwise, there's a ton of free content, a ton of free things that you can look up. either on your desktop or on an app. Obviously, we talk about eating nutritious meals, eliminating caffeine and sugar. We know that caffeine and sugar both increase anxiety. The reality is, most kids are not consuming caffeine. My hope is that most kids are not consuming caffeine and less sugar. And the reality of that is just we see the data and it supports it, right? Exercise, including it could just be movement, right? Because I know a lot of people see the word exercise. Um, Exercise decreases the stress hormone cortisol. It is proven that it decreases cortisol levels, which is the stress hormone. It doesn't have to be vigorous, right? But encourage and require any physical activity for 30 minutes a day. So I know that a lot of kids that I meet with in schools, now, how honest are they being about their home life? I don't know because I'm not there. But I think there's a lot of there's a decrease dramatically in physical activity. And a lot of that has to do, I think, with screens and society. And so I think the goal is just encourage movement. It doesn't have to be vigorous exercise, but it does need to be daily, getting them outside, taking a walk, doing yoga in the living room, right? Whatever it is, riding bikes, going to the skate park, taking walks with the family after dinner or in the mornings, getting them involved in some sort of sport or extracurricular, uh, doing some sort of like calisthenic exercise with your kids, whatever it is, movement is crucial, particularly when we talk about stress. Oh, great. Thank you, Ani. She posted a picture in the chat. So if you're unable to see it, there's a picture there. Obviously, healthy sleep hygiene. And I did a whole class on this. So that's another one that's going to be available for rewatching. Essentially, there's a couple of different pillars, right? The huge thing that I am passionate about is less screen time, if any, before bed. So really trying to set up healthy habits and teaching and modeling healthy habits to our kids in terms of screen time, particularly at night, right? We know that the blue light activates our brains. It keeps us awake. It's telling us, it impairs the melatonin mechanism. So the natural melatonin is not going to activate until that screen time has been eliminated, right? So to speak, from its shelf life with us, right? Like 2 hours and the melatonin can start to produce. So if you have a kid that's having issues like with sleep onset, decrease the screen time before bed or eliminate it before bed, and it is guaranteed to have that natural melatonin production settle back in. Deep breathing exercises, I talked about this already. If you type in progressive muscle relaxation in YouTube, that's going to be one of the best ways to use meditation and deep breathing to calm the body down. I already talked about that. Nutritious whole food diet, eliminating processed food and sugars. Um, there's a couple of skills, right, that we can teach our kids. One of them is learning their triggers about what they're nervous about, what they're anxious about, what they're fearful of. And so helping them do this can be huge. And it can be a literal brainstorm session where you just say, "Hey, I've learned some new things. Are you willing to talk to me about this? Let's kind of figure some things out together." And it might be over the course of multiple days or multiple weeks, kind of trying to figure this out. Hey, I kind of noticed that when this happens or when we talk about this, you tend to get kind of nervous. What's going on? What's your brain telling you during that time? Um, Helping them learn their triggers is incredibly helpful because most kids just do not know, and it's really hard for them to put that stuff together developmentally. Talking and sharing experiences with others, obviously going to a physician or therapist, seeking professional help if you feel like you need it, use your best judgment. Okay, so we talked a little bit about this already. That main difference between mental health versus stress. Stress and worry, it's developmentally appropriate at this age. It's developmentally appropriate across the span of humans. The difference is short-term situational stress versus chronic affecting all domains, social, school, family, sleep, biological impact, meaning appetite and weight, sleep, those kinds of things. Um, Use your best judgment, seek professional help when it's appropriate. I always recommend starting with your pediatrician. What I talk to most families about is that preventative action is absolutely better than reactive action, right? We want to start early, and while it may seem like, oh, well, I can't take them anywhere if they don't have clinical, the insurance won't pay for it. Well, then let's just do things at home, right? Let's just talk to the school counselors about parenting courses or things that I can do, resources I can give my kid, ways I can teach them some of these exercises, books that we can read, workbooks that I can buy, things that we can do in order to prevent a full-blown anxiety disorder versus like waiting until things are really, really bad. Normally, what we see is that the preventative action is obviously going to reduce the likelihood of a severe mental health diagnosis. I want to talk a little bit and shift the conversation a little bit to chronic stress. But what I'll do here is because I did not pause, I'm going to pause and just take any questions that anyone has, ask if anyone has any feedback or any personal things that you want to ask about in terms of the information that we've shared already. Anything coming up for you guys that you guys want to ask or chat about? Any questions? Okay. I'll stand by for questions. I'm going to keep trucking along. All right. So we're going to talk a little bit about, like I said, shift the conversation and talk a little bit about chronic stress. So I think one of the biggest reasons that I talk about chronic stress, and I think that this really relates to parents as well. Um, there have been so many studies that have come out that show that exposure to stress long term actually shortens our life expectancy, right? And there's this whole thing, you can look at it on YouTube. It's this talk by Robert Sapolsky. It's called Why Zebras Don't Get Ulcers, right? And the whole idea is that like zebras don't get ulcers because they're constantly being hunted by lions, right? They have, and the reason why is because they have episodic stress, very short bursts, right? They're running for your life, running from their life, for their life from a lion, but it's very short and it's cyclical. There's so many of them, the same one's not being singled out every time, right? So it's very episodic and short term. And the reality is humans, his kind of argument, right, in this kind of humorous way, is that humans get ulcers because we have chronic stress, right? We're more likely to have sustained stress. It's not short term, it's long term, and it's cyclical, it's chronic, right? It's happening over and over. And that could be something like we're constantly worrying about losing our job or financial constraints, constant anxious rumination, right? A negative thinking style that is really turned into constant rumination, which is kind of the hallmark of anxiety. Anxious thinking style left unchecked, right? We're talking about that anxiety cycle. And if we continue to just allow that stuff, right, it becomes chronic. It's not this like short burst of normal stress or, like I said, worry, normal nerves, normal worry, normal fear. It becomes this chronic, sustained thing. And this is where we really get into trouble as human beings, right? Because what's happening is that fight or flight response, the central nervous system, in particular the sympathetic nervous system, is activated, and there's a huge biochemical dump in our brain and body, right? Huge dump of adrenaline, huge dump of cortisol. And so if that's happening constantly, right, that biochemical dump is just like filling up, right? Now, this is really important, and why previously in the previous slide I talked a lot about movement and your diet, what you're consuming, the caffeine, the sugar, the foods that we eat, how we eat them, right? A lot of that stuff helps manage that biochemical dump. And that's why there's so much data supporting caffeine and, alcohol, like some of those things, because those chemicals are not, reducing the biochemical dump. They're agitating that, right? So the cortisol and the adrenaline has nowhere to go, and it comes back in chronically in a sustained way. And so that's where we get into trouble, right? Now, what I was talking about is the importance of this is that the adaptive responses, exercise, meditation, visualization, even massage, deep breathing, progressive muscle relaxation, yoga, like all of those things, right? Running, biking, those are considered adaptive responses versus maladaptive responses, which are like technology, drinking drugs, binge eating, overscheduling or overworking, sleep deprivation, various addictions, gambling, sex, social media, right? All of those kinds of things. When we have chronic stress, we can either have adaptive responses or maladaptive responses, right? And that too changes our body's response to what's happening to it. And so, one of the things that we find most concerning when we talk about chronic stress is that these studies, right, pointing out that exposure to stress long term, it's shortening the life expectancy, and predominantly because it's causing and or exacerbating physical and mental health conditions, right? So when we have prolonged or chronic stress, which is would be another reason to seek professional help or expert help, right? Because these things exacerbate depression, anxiety, migraines, heart disease, ulcers, colitis, rashes, or skin conditions, reproductive issues, insomnia. So we know that all these health conditions can be very linked with our with chronic stress. And so, causing this much of dysregulation, both physically and emotionally, we know that this is incredibly important for us to pay attention to. And so, I don't know if it was this session, but it might have been last series. I did one on specifically on mindfulness and meditation. And if I didn't do that one this time, maybe I'll do that one next time, just to kind of talk about some of the data and really give, try to buy people in and give people some information on how to do that to just help this, because I think a lot of us um, are under chronic stress, particularly in the economy and with what's happening in the world. And without going into any of that, I think the reality is a lot of us are under stress. And so this might really help us as parents. And if I can help parents, then it means we're helping kids. So um, perhaps if you guys want to see or hear something about that, let us know in the feedback form, and maybe we'll add that presentation in. Um, to help address some of that. Okay, so we talked a little bit about sources of stress in the beginning. I asked you parents, like, tell me what your kids are stressed about. Um, Predominantly what we see, and we see like different worries and stress at different ages. Um, Annie just shared the survey link in the chat if you're interested. It's anonymous and you can just put whatever you want in there. Let us know how we're doing. Give us some suggestions. There'll be a couple minutes at the end for you to fill that out. So, some of the sources of stress, and I would say predominantly, right? We talked a little bit about it being in certain domains. A lot of it is going to be academic, and a lot of it's going to be social or intrapersonal. And so, what we see as really common sources of stress or chronic stress Tension at home from parental conflict and or divorce. This is really, really tough on kids. We know that it is. Um, I see a lot of this in the practice that I currently have, and that is just working with parents on how to reduce their parental conflict will absolutely help the kids involved. And so sometimes that's even just a good starting point if you don't know where to start or your kids don't want to go to therapy. I get that a lot where parents are like, "Well, my kids don't want to go," and they're not agreeing to come to therapy. I always say, "Well, let's start with you." And that's in a very just genuine, compassionate way. Like, let's see where we can help you. Tell your kid, your child that I'm going to help help them by helping you. Tell us what we need to do, what we need to work on, how we can be better. And I think that's a really good place to start because it does tend to be a very significant portion of stress for kids if that's happening at home, if there's tension or parental conflict or separation or divorce. Significant life changes, moving homes. We talked a little bit about this, birth of a new sibling, a new step parent or a new family member in the family dynamic. These are very big, and sometimes these things happen all at once, right? Conflict or divorce, and moving homes, and a new step parent or family member. And so when we talk about a lot of this, there's just a amalgam of change. And this is really hard for kids to deal with. I think it's really hard for us to deal with. And so, considering that it would be hard for us, it's absolutely difficult for our kids. And so just kind of being aware of that, like these are things that are going to really cause my kids some stress. And there's something I can do about it, right? I can talk to someone, I can read some books on it, I can get some information on it to help lessen that stress impact. School challenges is one of the top sources of stress for children and adolescents, and that's kind of across the board. It's just going to look a little bit different. It'll manifest a little bit different. Making friends, dealing with bullies, getting along and getting used to teachers, uh, accustoming themselves to the academic performance. I see this a lot with kids who go from kinder and first to like second, third, fourth grade. They're learning how to manage the pressures and the demand of academic performance. Teen sources of stress are more related on increasing pressure around grades, graduation, right? That transition from teenager to adult. What am I going to do? Where am I going to go? Am I going to get a job, right? How am I going to support myself? What will be different? Social pressures regarding fitting in is probably one of the biggest ones for, I would say, middle schoolers and teenagers. Middle school is a really tough time. I tell a lot of parents that I work with it's the hardest because it's a kid going from being a child to a teenager to a young adult. It's very, very challenging because of the hormones, because of puberty, and because just in general that transition is very, very, very challenging. Um, so teens, social pressures of fitting in, first romantic relationships and or sex, substance usage and experimentation, as well as societal concerns, political concerns now with like things like gun violence or school shootings, rising technology, social media use, addiction, and suicide rates, climate change, the treatment of immigrants. All of these things are going to be things that teenagers start thinking and becoming stressed about. Because also we see that enhanced cognition in teenagers, right? They're more able to conceptualize some of this stuff and think about this stuff and also empathize with some of these things. So we just see much more of this emotional impact and stress impact because of that change when we talk about teenagers. Sexual harassment, cyberbullying, things like that happening on social media, physical fighting, um, lack of resources and environments at schools, all of that stuff. Okay. More ways, strategies to support your kids and resources to take with you. So I am going to, in the next couple of slides, we're really going to talk about like these are coping skills, giving these things to your kids. Also, ways that you can communicate with your kids in a way that is very supportive, very compassionate. And yet, we're also going to talk still about setting boundaries. You're still going to do all of those things, even in the context of a kid who's struggling with worry, fear, or a clinical anxiety disorder. And then I'll give you guys some of my favorite book recommendations. Okay. So one thing that I try to help parents with, one of the predominant things that I try to help parents with is communication with their kids and how to utilize conversation to show support and to connect before we correct, right? So when we talk about specifically with kids who have, we'll say, mental health diagnoses or verging on mental health diagnoses, what we do know is that homes where kids have less warmth and more demand, they tend to have more anxiety and depression, right? And that's across the board. We know that parental control is associated with higher rates of anxiety and depression. And so, what we want to do is say, okay, how can parents be softer, right? Support, be more empathetic, be more warm instead of reprimanding, educating, lecturing. Now, that doesn't mean that we don't do those things, but I think it's more often about timing and the relationship. So I talk to parents a lot in the positive discipline classes. If you missed it, go check those out about the relationship that you have with your kids. Because if your kids can't talk to you because they don't have a great relationship with you, nothing else is going to work, right? That is our foundation. That's the base of our home that we're going to build. We need that to be really strong. And if it's not, we have to repair that first because a lot of times I tell parents, okay, use your communication, use your conversation to support them. Well, they're like, but they don't listen, right? They don't want to talk to me. And it's like, okay, well, then the relationship is damaged. And how do we repair that? We start by repairing trust. We start by like really calmly apologizing, gently saying, I've done some things wrong that I regret. I know that I shouldn't have done this, this, and this. I'm sorry. I want to repair. I want to fix it. Will you let me? Right? And we kind of humbly come before our kids and we do those things, I think. And that does not mean that we lose parental authority or credibility. It just means that they see us trying and it means that they see us wanting to change things. And so it's not, is it going to work right away? Maybe not, right? That might take a long time to repair the trust if it's been damaged. But I do believe that most parents get some success when they try it in this way, right? So I really encourage parents like try not to minimize, try not to dismiss or invalidate, right? When they say things like, I'm so stressed out about this, or it's like, oh, well, it'll be okay, right? Or however we respond to that, right? Oh, well, like you'll get over it, right? Or like, oh, it's just a phase. Or, oh, it's going to be fine. Or like, oh, you're just complaining all the time. Oh, like it, because those things, while maybe you're at the point where you're just like, oh my gosh, I can't even handle this, right? The reality is that they see that as dismissive. They see that as an invalidation. And while we want to teach them and get them exposed to certain things like disappointment, like worry, like fear, like, all of these things work and you know, I think what I'm trying to say is that we put effort into things and we get what we put into it, right? We get back what we put into it. We want to teach our kids these things, but we want to do it in a really respective, kind of strategic way so that it doesn't feel like we're constantly invalidating their feelings. One of the things that when I teach parents about validation is very specifically just because you validate your child does not mean that you agree with them, right? And I say this to a lot of people, whether it's in the context of marriage or relationships or, child parent relationships, friend, just when you validate somebody, it doesn't mean that you agree or you think they're right. It just means that you're willing to show by way of your behavior and your statements that you can understand where they're coming from, right? We're just trying to get that message across because that's sometimes the most crucial thing you can link with that, right? They will hear you if they feel validated. They will hear you if they feel like that bridge has been crossed. Whereas if not, they're not even really willing to listen, right? So we want to learn validating language. We want to learn to empathize and respond, even if it doesn't make any sense, even if we think they're wrong, even if we have this explanation of how, oh, it could have been this, or oh, you could think about it this way. We're just going to start with validating them because that's really all people want is to be heard and be validated by someone else, particularly those that we love and care about. So another way is what I was talking about in terms of like you're going to build the relationship, you're going to try to start there, repair trust, apologize if you need to, but we're going to try not to reinforce the anxiety, right? We're really going to try not to promote or allow avoidance because this is what reinforces that cycle, right? So if our kids say like I'm really scared to do this, well we might encourage them in small ways to do that thing, right? Now, obviously, this is going to be something that if we're doing true exposure therapy, you're going to need professional help. But if you're trying to do this okay, my kids stress about giving a presentation. Well, okay, let's start by my child preparing a small presentation on something silly to me or in front of the family, or right, we'll look at pictures or videos of what it's going to be like to give a presentation in front of a lot of people. We're going to slowly expose them to this idea. And maybe you get a couple of your friends or a couple of your neighbors, right? Like we can use these things to help expose kids to what they're afraid of without really again invalidating them or going too far and saying, well, we're going to push you to do it and like you can't be afraid of, it's you've got to do it. So I think there's a way to kind of meet in the middle and get them to the point where they're able to do those things without being very debilitated by that. We're going to definitely encourage modeling, right? And I talk about that probably in every session. It's in my bullet points. The best ways to support our kids is to model the appropriate emotional awareness, the appropriate stress, like coping with stress, right? If we model movement and exercise, if we model a low caffeine, low sugar diet, right? Whatever lifestyle, if we model meditation or journaling or doing some of these processes, this is what our kids see and this is what they learn. And I always tell parents, your kids will not do what you tell them to. They will do what you do. And this is why modeling is so crucial. It's because that's how kids' brains work. It's called mirror neurons. We can't go into it now, but if you're interested in it, just look it up. Kids will mirror what they see. They do it all the time. It's how kids learn how to walk and talk in such a short span of time. So model all of these things to them, do your best. Get them a journal. Get them what kind of hobbies do they like? What kind of artistic or creative things do they like? How can we weave that in to get a child to reduce stress by doing these things that they enjoy? Excuse me, journaling is a really wonderful tool. There's a lot of research on gratitude journaling in specific, like thinking of two or three things that you're grateful for every day and using that daily. They actually show a drastic improvement in mental health when we do gratitude journaling. So that can be a really helpful thing. Or it could be something that you guys, if you don't want to do a journal, you do it at dinner, right? You guys have family dinner. Hopefully, some of you are having dinner, family dinner, if not all of you most days of the week. But you maybe do that. Let's do some gratitude journaling or some what two things are you grateful for today? And kind of lead that conversation that way. We talked a little bit about supportive networks. So healthy friends, healthy outputs, healthy movement, right? We talked about diets. Um, Minimizing all those things. You are in control. If you don't buy it, it won't be there. Obviously, we're not talking about if kids aren't at your house or if they're at school or if they're at friends, but you can only control what you can control. I think my final point here is that parents modeling self-care and stress management strategies is the single best way to create resilient kids. Your own healthy coping, sharing your experiences in a healthy way, this provides your kids with permission to be overwhelmed, permission to feel nervous and scared, permission to feel anxious. And it's their roadmap of how to regain control over their circumstances. So I'll echo what I said earlier. When parents get better, kids get better. And so that's a really helpful thing to know. And here, I don't think we have a ton of time to talk about this particular book, and I will get into this when we do the social media conversation 3 weeks from now. So the last Virtual Parent Academy is going to be on social media and technology. This is one of the books that has been kind of most influential, I think, in the last like couple of years talking about how social media has impacted our youth. And it's called The Anxious Generation by Jonathan Haidt. Recently, I think when I was doing these classes when this book first came out, it wasn't getting a lot of traction. And then I think in the last like year and a half, he's been on Oprah, and there's really been like an influx of people learning about this and seeing this data and this research. And so John Haidt is, I think he's a psychologist. He works in the same field, and he has been doing essentially research on how smartphones are behind this worrying rise in child and adolescent mental health issues. Um, he believes, and the data supports, that play-based childhoods and not phone-based childhoods promote healthy development. And so that's kind of what we're seeing, particularly because we have that data showing us that in the 2010s, which is when the first iPhone really rolled through, was when we see these large peaks in this change in child and adolescent mental health. So he talks about sleep deprivation, attention fragmentation, all of these things that really comes out of smartphone use. These are dangerously impacting our children's health. And all these negative impacts can be curbed. And so he's really big on talking about how to fix it, how to change it. He is a wonderful, I think, just clinician doing wonderful research. I'm very passionate about social media um, because I've been doing this research, and I just see how important it is. So my hope is that this can get some momentum. And if you're interested, check it out. Another couple of good books. I told you guys Reparenting the Child Who Hurts by Archer and Gordon. A Thousand Hours Outside, Ginny Urich. That is a book where she basically is talking about this whole like adventure play-based childhood versus screen-based, and how to like get our kids outside. There's a whole like challenge that people are doing where they're getting outside with their kids for 1,000 hours every year. And it's just really, really cool stuff. So if you're interested in any of those, check those out. Um, Let's see. Okay, so there is a PDF booklet that I shared. Annie shared it in the chat just now. So it's the second PDF file called the Anxiety Common Unhelpful Beliefs little it's a PDF file. And so you can open that up, and essentially those are exercises that you can do and you can teach your kid. You can do them with your child, and it's essentially going to help you reframe specific thoughts, and it gives you a little bit more information on that and how to do it and why it's important. These are techniques that I use in therapy with families, with kids, with adults. And I wanted to share it because I want it to be something that you guys have to take home with you and to use. You can practice those things. I do think that it will really, really be beneficial. Are you guys able to see, Annie, did this change over to the PDF, or is it still on my presentation?
It's still in the presentation.
Okay, give me a second. Did that work?
Yes.
Lovely. Okay. All right. So, essentially, right, when we talk about treatment of anxiety or just like how to help people who have anxiety, fear, right? Feeling nervous, anxious, or frightened, it has a lot to do with how we think. I talked about that in the anxious cycle, the little chart that I shared with you guys with the anxious cycle. And so here's what we can do is you could give this to your child and show them what are some of these, like on the left side, what are some of these common anxious thoughts that you have? Right? And get them to write some of that stuff down, get them to check some of the boxes. It could be like, I'm not safe, or something bad's going to happen. Other kids will make fun of me, or kids don't like me. Um, when I have a test, I think I'm going to fail. And so you would get your child to write some of these things down or talk to you. You can talk them through this. And then what you're going to do is kind of switch to, okay, what are some of the common helpful thoughts we can have, right? Now, these really don't want to be, we don't want these to go from I'm not safe to I'm completely safe, nothing bad is ever going to happen, right? Because like your brain can't latch onto that. Nobody's can. But what you could say is something a little bit more neutral, like most of the time, nothing really bad happens, right? And this is one of those ways that our brains can latch, it's away from the like, I'm not safe, but our brain can go, oh, okay, yeah, most of the time it's more neutral. Nothing really bad happens, right? It's a little bit more believable and easier for our brains to believe. Now, the whole purpose of this is you're going to kind of go down the line and you might just say, okay, um, I'm scared all the time, or I have to watch out for danger all the time. Well, I can tell myself it's okay to be scared sometimes. It's okay to be afraid sometimes, right? I'm pretty brave, or I don't let the fear stop me from doing things that are important to me, right? So you really try to get them thinking with a little bit more brave or helpful thoughts, right? Now, the second page that we're going to, this is called the cognitive triangle. And it's an exercise that we use very frequently in cognitive behavioral therapy. And what that is we're going to write here triggering situation. What event happened, right? Maybe at school it was a kid forgetting his pencil or being late to class, right? What were the immediate thoughts that you start to have in your brain, right? Now, I will tell you, most people they just go like, "Oh my gosh, I started feeling bad and anxious and sweaty and I don't know why." You got to really get kids to like, okay, introduce this topic to them and then maybe in the next week say, "Okay, start paying attention to your thoughts then. When you start to have that bad feeling, start to think about what your brain is telling you, right? What is your brain saying?" And you might get them to like write down, is it some of those negative thoughts that we talked about before? Or are there other ones? Then you're going to kind of write those thoughts there. What are the feelings that you start to feel, right? Some of the feeling words. What are the sensations in your body? Do I feel hot? Does my heart start to race? Do I get a stomach ache? Do I have to go to the bathroom? Do I want to run away? Do I start to run away? Right? And then what are the behaviors? What do you do when you feel that way? Most times kids shut down. They stop talking. They walk away. They might start to cry. They might act out, right? And so we might start getting them able to pinpoint some of these things. And then we might start to help them understand, okay, these are reasons why you think this way, right? And then we do this process over and over again, and we really teach our kids how to change their thinking, which, like I said before, is one of the main reasons it's one of the hallmarks of anxiety, right? This ruminative thinking or unrealistic, unhelpful thinking. So if we can teach our kids to do it, show them how to do it with them, it can be incredibly helpful. So take that with you. I hope it's helpful. I'm gonna pause for questions. We're almost out of time. Does anybody have any questions, comments? Things that you liked out of today's presentation, things that you didn't like, any feedback or comments?